We get on with the anatomy of the adrenal glands. The adrenal glands are two small caps sitting on the upper pole of both kidneys. The right one is of a more pyramidal shape and the left one looks more semilunar. Now I want to show you the position of the adrenal glands and the adjacent structures on Hippocrates, our model. So we got both adrenal glands, the right one and the left one, in the retroperitoneal space. And as you can easily see, they are not only superiorly, but also medially of both our kidneys. Now for the neighboring structures, let's go to the right side first. We got the right kidney over here. And another neighboring structure is the inferior vena cava. And an important landmark to find the adrenal gland on the right side is, of course, the right liver lobe. Here, adrenal gland, kidney, inferior vena cava, and the right liver lobe. Now let's go on to the left side. Of course, we got, again, the kidney, in this case, the left kidney over here. And another landmark for finding the left adrenal gland is the aorta over here. And of course, the spleen on the left side of the patient. In this picture, we see a view from behind, a dorsal view, and we can see the aorta, the inferior vena cava, and the left and the right kidney. And here, at the upper pole of the kidneys, we can see the adrenal glands. And now we can easily detect that the adrenal glands are not seated only superior, but more medially of the upper pole of the left and the right kidney. And this is important to visualize the exact position of the adrenal glands in the body, so we can be able to scan the right area when we perform an ultrasound examination. Imaging the adrenal glands in adults with ultrasound is basically a rather tricky thing, especially in the beginning. It took me really a long time to be able to find them, and even now, when conditions are not ideal, we often can't visualize them. But why is it important to visualize the adrenal glands? There is the possibility of tumors that can also have an endocrine function. You remember, for example, Conn's syndrome in hypertension or pheochromocytoma. So what can we do now? When I started with abdominal ultrasound, I got really good advice from a nice colleague. He said, even if we can't really depict the adrenal glands, we can at least thoroughly scan the area where we know the adrenal glands are positioned. And this is what we are going to do now. Now let's take a look first at a picture of an adrenal gland, what this organ can look like when detected. In this picture, we see the spleen over here and the left kidney, the upper pole of the left kidney. And when you really look closely, you can detect an area here. It's pyramidal shaped. And when you know what to look for, you can see this region over here is the left adrenal gland. So this is what an adrenal gland looks like when it is detected. So what are the approaches for scanning the region of the right adrenal gland? We can either use a subcostal approach or even better, a right lower intercostal view. We place the transducer either in the intercostal area, in a longitudinal position, or at the right lower intercostal space. Now, what are our landmarks when scanning the right adrenal gland? We got the right kidney, the inferior vena cava, the inferior crus of the diaphragm, and the right liver lobe. Typically, the right adrenal gland, when visible, can be displayed behind the right lobe of the liver, is lateral to the vena cava inferior, and anterior to the inferior crus of the diaphragm. We want to show you how you can succeed in scanning this tricky region, and we will perform an examination of the adrenal glands on our ultrasound model now. Let's go to the machine.
To display the adrenal gland on the right side, we use a longitudinal scan in a very lateral position, and we display our landmarks: liver, kidney, spine, and the IVC. And in the region in between the liver, the kidney, and the IVC, we can detect this triangular structure over here. Maybe we can improve the picture when the patient takes a deep breath. Please inhale and stop breathing. And so we can see the adrenal gland on the right side over here. By tilting the probe slightly up and downwards, we can check this region and easily detect any pathology on the right adrenal gland over here.
For scanning the left adrenal gland, we use a left lower intercostal view and place our transducer at the left intercostal area. The key landmarks for the left adrenal gland are, of course, the spleen, the aorta, and again, the inferior cruise of the diaphragm on the left side, and also the upper pole of the left kidney.
In order to get a good view on the left adrenal gland, we use a longitudinal scan in a very lateral position, and we look for the landmarks on the left side, the spleen over here, left kidney, the spine, lumbar vertebra, and the aorta in this region. So when we scan this region of interest, in between the spleen, the left kidney, and the spine, we can very nicely detect this normal finding on the left adrenal gland over here, and can take a nice picture of it.
The most important pathologies we can encounter in ultrasound of the adrenal glands are different kinds of tumors. Tumors of the adrenal glands are often so-called incidentalomas, incidentally found lesions. In adults, most of them are adenomas, and in a lot of cases, they are clinically silent, but they can be hormonally active, causing, for example, Conn syndrome or Cushing syndrome. Usually, they are benign, but there's also the possibility of malignant tumors of the adrenal gland, especially when they are larger than 3 centimeters. Except from adenoma, we can also find hyperplasia of the adrenal glands, pheochromocytoma, carcinoma, and even metastasis. For detecting a lesion of the adrenal gland, we need to assess the region of the organs thoroughly in our ultrasound scan. When a tumor in the area of the adrenal gland is found, further investigation is indicated anyway. Now I've got a fascinating story for you. In this case report, the patient was a 40-year-old woman, a florist, and she was a friend of mine. She had a 5 to 6 years history of hypertension and complained about repetitive hypertensive episodes. No antihypertensive therapy, even combinations of 3 antihypertensives, had brought persistent therapeutic success. She had a lot of work because she owned a flowers shop, she was a mother of 3 children, and so she had a lot of stress. So she explained herself the hypertensive episodes with her lifestyle and responsibilities. But when I took blood samples of her, I saw something else. She had a hypokalemia of 3.1. And I asked her about that. And she told me that she already had an episode of mild hypokalemia a few years ago. So what do you think I was suspecting now? You're right. I thought about a possible Conn's syndrome. And of course, I carried out all the required blood examinations. But since I'm a sonographer, I immediately performed abdominal ultrasound. I'm a curious person and can't wait to take a look inside my patient's body. In this case, of course, at the regions of the adrenal glands. Do you think I found something? In this case, I'm going to start with a video clip. And this is the right side of our patient. And I just give you 1 minute to take a look at the picture or the video clip yourself. Do you see something suspicious? Take your time. Just take a look at the region of the right adrenal gland. Got the right liver lobe over here. It should be the right kidney. We can't detect it now because there's a lot of colon gas, but this is the right region. Here we got the inferior vena cava. And there is something, a small round object in the area of the right adrenal gland. So this is highly suspicious of an adenoma and maybe the reason for the problems of our patient. Here we got a picture. Again, the right liver lobe, this small object over here. And it's about 2 centimeters. I think it was 1.8 centimeters. The structure in the area of the right adrenal gland. Here again, the measurements. So, of course, we carried out an MRI, and this confirmed a 2.5 centimeter tumor of the right adrenal gland. It was even a little bit larger in MRI. She had an elevated renin-aldosterone quotient, and of course, she was sent to the endocrinologist for further investigation. So, an aldosterone-producing tumor of the right adrenal gland was confirmed, and this was an indication for surgery. In this chapter, we recapitulated the anatomic features of the adrenal glands, we learned how to scan the region of the adrenal gland, and we talked about possible tumors in this area.